Right. I think we'll come back and get started. Really excited for this next session as well. So we have Lisa Brooks. She's been a community health worker for 10 years. She's a community health worker mentor. She's a diabetes and chronic conditions educator. She's a member of the Wisconsin Public Health Association. I'm guessing that's what WPHA stands for. Yes. Okay, I guessed right. Specifically the community health worker section. She's a member of the Community Health Worker Network Advisory Committee. And she won the Walk the Walk award from the State of Wisconsin Community Health Worker Network in 2021. So lots of credentials, Lisa. Really, really excited to learn from you. So I'm going to hand it over and let you be the star of the show.
Thank you very much. Good morning, everyone. I'm going to pull up my slides in just a second here. Okay, perfect. So again, my name is Lisa Brooks. I am a community health worker. I am currently working at an HMO with a specialty in housing and working with the homeless population. So there are two types of populations that you will hear about: those who are homeless with the HUD definition, that live on the street and who do not have a functional or a habitable place to live. So they may be living in their cars, living in parks, living in abandoned buildings, people who do not have four walls. Anyone that is inside of four walls is considered house hopping and is not the definition of the people that I would normally work with my specialty, but all the same, the need is there, we do. So in the past couple years, due to COVID, the face of homeless people have changed. This is the face that we would have seen maybe 4+ years ago. And these were people who had mental health or behavioral health issues, or those who had chronic unemployment. Next slide, please. And now after COVID, this is the new face of homelessness. These are business people. These are children. We're seeing an uptick in the children. Blue collar, white collar workers who their jobs had shut down and they had no income. So it changed up the whole atmosphere. And some of those people who were newly reported as homeless didn't make that criteria for some of the programs. If the income of a white collar worker or a blue collar worker exceeded a certain amount, those programs were not available to them. So we still see some of those who look like, dressed just like the gentleman in the picture. He goes to work every day and he probably goes home at the end of the day, his car being home, gets a shower probably in the neighborhood YMCA, and he goes to work, and you would never know that they were homeless. And this is all due to COVID shutting down places of employment, creating a bigger hunger for these students, as you heard in the last presentation, where they were helping these students to find food. So the face of homelessness is not what we saw on the previous screen, but what we're seeing on this current screen now. It has affected everyone, just as COVID. Next screen, please. So who are the new owners of the new faces of homelessness? Again, those are those white collar workers who were in those offices, those business firms. These are businessmen and women who are facing homeless, some for the first time in their lives. Those factory workers on shipyards, COVID shut down shipyards. Bus drivers and cooks no longer had a place of which they could go to work. Therefore, it affected their home life because they weren't producing paychecks. Families with and without children, the children are the worst because they had nothing to do. There was nothing those little ones could do to help out with the family who were put on the street. They were just casualties in this war of homelessness. At any time, anyone could be homeless, and most times through no fault of their own, just as COVID has shown us. Next slide, please. So, national statistics versus state statistics. Over 1.2 million children were homeless last year across the United States, and 18,000 plus were just in the state of Wisconsin alone. So that number went up from 14,000 to 18,000 over the last couple years. Now, this report came out in 2018, looking at the 2018-2019 school year. So I'm sure with 2023, we've had even more of an uptick because as you see, or as you heard in the last presentation, that children are being put out on the streets with their families. They're doubling up. There are 14,000 of these students who are double up, staying with family members, friends, sleeping on someone's couches because they have nowhere to go, living in tents on campgrounds. These are where these children and their families have been put or are until they can find help. Next slide, please. So this is a statistic showing the rise, even though there is a little dip in 2014 to 2015. This is from 2003 to 2015. You'll see the number has steadily went up and dropping off in 2015. Again, this does not show the impact of COVID on homelessness. This number is shown just the last 12 years. And that is a very frightening number to know that 20,000 students in Wisconsin over the last 12 years needed help because they were homeless. Next slide, please. Urban versus rural. So in 2015, it was reported that the state of Wisconsin had that 18,390 students who were homeless in Milwaukee, Madison, Racine, and Kenosha, reporting only 8,200 of those students. So that meant that the other 11,190 were in rural counties spread throughout the state. It was also reported that those rural populations see the least amount of services, the least amount of funding to get these things done or to assist these families. The major cities taking the bulk of the money, and we had the least amount of students in the state of Wisconsin, and the money went mostly to the larger cities. Kind of, I won't say fully overlooking, but not really addressing the need of the rural communities. Next slide, please. So here's the homeless population in the United States. You'll see it is at about 1.3 for 2018 and 19, and you can see the projection as it is going up. And this is from 2009 through 2019, and that number steadily going up. Again, it is not showing the impact of COVID. So we're looking for those numbers to be at least 2,000 to 4,000, maybe even 6,000 higher than the reported numbers now. Next slide, please. So what are some of the effects of homelessness? When a person does not have housing, it jeopardizes their safety and their stability. It leaves them exposed to the elements and exposes them to those unsafe environments. It disrupts their normalcy. It is no longer an organized and structured way for a child to live. It affects how they go to school. They may be parked on the other side of town from where their school is and can't get to school on time. It interrupts their medical, making doctor's appointments on time because mom doesn't have that schedule pinned up on the wall anymore. She's trying to figure out, how do I get my kids into a safe environment where we can sleep at night that's habitable? So it disrupts a whole child's life. It can cause them to have behavioral health problems as anger and frustrations and having outbursts at school when they do. It also can make a child become embarrassed and an introvert because they don't want to share that problem. Kids can be cruel sometimes for as lovely as they are, and they can pick on a child who's homeless, and that we don't want. It affects their self-esteem, the embarrassment about the situation, the shame. about the misfortune. It could cause the child to be withdrawn and even isolated. Some children who have after school events will tell the teacher or whoever's dropping them off, drop me off at this gas station and I'm going to get a soda and I'll go home from there, only to go let the teacher or the coach leave to walk to where the car is or where their encampment is or wherever they're at for that night. So homelessness affects a lot. It steals the hope as a person may or not know where to get help or if there's even help. Next screen, please. And the daily impact on homeless children, it is devastating. Their education, physical and mental health, their sense of safety and their overall development. These children experiencing homelessness frequently need to worry about where they'll live, their pets if they have them. What about their belongings, their favorite jackets, shoes, hats, shirts, and the other family members? They can also are less likely to have adequate access to that medical and dental care and may be affected by a health of challenges due to inadequate nutrition and access to food. The interruptions in education causes trauma and disruptions in the family dynamics. Next slide, please. The good thing is there is help for the homeless. In each county, there is a organization or agency designed to help these families. Some of these are called your coordinated entries. Some are the Salvation Army that provide funding for rent and security, household furnishings, even clothing. There are peer support for people who have experienced homelessness, and I can identify with the feelings of loss and can help model rebuilding and inspire that hope. Mental health, places that support those who go through depression and anxiety caused by being uprooted, and housing support by community health workers helping find landlords who will rent to those and help fill out the application for housing. There's also free clinics. While homeless is the last thing on the person's mind, is their health. They may live further than their personal care physician. And they may need to be picked up. They have issues picking up those medications and follow up on prescribed care. And a host of other issues, services that homeless population would need to be made whole again. So everything from your coordinated entry, your 211 in Wisconsin, you can dial 211 to start that process, and a host of others, as I said. Next slide, please. Coordinated entry is a big one. They're usually, if in different counties, they're called other things. You can contact your balance of state, and they will let you know who the agency is for your coordination. But what they do at coordinated entry is they do an intake, and it's a process designed to quickly identify, assess, refer, and connect people in crisis to housing and assistance. No matter where they show up to ask for help, it can pave the way for more efficient homeless assistance system by helping them move through the system faster for housing, reducing new entries into homelessness by consistently offering prevention and diversion resources up front, and it improves data collection and qualifying and providing accurate information of what kind of assistance consumer needs. So if a person is referred to me through my HMO, then what I would do is the assessment to find out what is needed. Is this, are they evicted, or what is the issue that bring their housing to this status? And once I've found that out, as was said, we create a plan. This plan is self-directed. This is not something where we put them in a place. It's a place where they want to go. They have a lot of say in what they do and how we're doing things. If they don't like what's going on, we try to figure out a way with their help for them to get the type of housing where they'll stay. What we've learned is if you put a person in a place that you picked, they're probably not going to like it and abandon it, which means you're going to start that housing process all over again. So each person is different. So we want to help them move through the process through coordinated entry using those services. Again, 211. There's the balance of state that could tell you for each county who your coordinated entry is. Next slide, please. How can you help? By being an active listener with compassion and not being non-judgmental if someone comes to you looking for support is key. As a community health worker, I am from my community. So a lot of people see me, whether I'm out in the grocery store, I'm just their next door neighbor, or the lady lives down the block, that one that's always talking about different stuff, where to get things from. So you are, as a CHW, you are very well known in your community for helping people and having resources to give. So you can place information on your bulletin boards about homelessness prevention places such as American Red Cross, the Salvation Army, United Way. We have 211 as well. You can put these things on billboards or put pamphlets on tables where people can walk up and look at them or take them as needed. And not even, they don't have to even say, they can remain anonymous while they're there picking up the pamphlets, and if they need help, they can come and ask you for the help. I need more help, and ask questions about those pamphlets which you have. You can hold monthly or bi-monthly in-services facilitated by homeless prevention agencies. So these services, people can come in, have a seat, and learn and get signed up, and get assistance right away versus waiting. You can place again this information in visible areas so that people can pick them up again without that judgment. Those are those bulletin boards. In services, when there are different like health fairs and things of that sort, I find it helpful. Food banks, just being there to give out the information. If they're having a food crisis, 9 times out of 10, there may be something with housing or some other social determinant of health of which you can help. But just by displaying the information and being ready to have the conversations, these things can go a very long way when you're dealing with the homeless population. Next slide, please. So there were a total between 2015 and 2016, a total of 22,000 people that were served. They were placed in emergency shelters, transitional housings, and even safe haven projects. Of those people served, 46% were families with minor children. 58% were communities outside of Dane and Milwaukee. 9% were U.S. military veterans. 8% met with federal definition of chronic homeless, which means that they were homeless at least 3 to 4 times within a 2-year period. And 2% were runaway homeless youth under the age of 18. So there's a variety of looking at the different people who are homeless and the ways that they are categorized and the way that your community receives funding for them. Okay, so I am open for questions.
Lisa, one of the things that you mentioned was that the face of homelessness is changing. So what we typically sort of associate as, or might think of as sort of signs of housing insecurity or housing instability might not really play out. So what are some of the things that providers can look for? Like, what are some of the what tips you off that maybe you should check in or follow up?
Our referrals come to us. Again, I'm at an HMO, and they will come saying we do an annual assessment, a health risk assessment every year. And from this assessment, it talks about these things, housing and food insecurity and social determinants of health. And once that assessment is done, and let's say a person says that they're concerned about their housing, it generates a referral to me to look at this and say, hey, they're concerned about their housing. So then at that point, I reach out to them, do an intake. What is it about your housing? Is it a safety thing, or is it mold, or is it an eviction notice, or what is it about the housing that concerns them? And it could be a variety of things, like I said, from having mold in the home, safety issues, but most are evictions for me. They've gotten an eviction, and my job is to educate, advocate, and empower. So it could be something like calling the landlord, trying to keep them in that unit. And if it's an issue with funding where they're about to be put out because they don't have funding, that's when I'd reach out to community programs such as the Red Cross, United Way, Coordinated Entry to find funds to keep them in their home. Where was one before their funding ran out. So it's a variety of things when we say homelessness. Um, but it all leads back to that intake and the assessment. What is causing it, and what can we do about it to prevent them from hitting the streets? And if they're already on the streets, what can we do to get them into a building with four walls?
So kind of related to that, so when you're trying to do that, when you're doing that really important work, what are some of the biggest challenges that you run into?
I
Like when you try and connect someone with resources, like what are your biggest challenges and how do you get over them?
Usually the first one is people not having all of their supporting, what we call supporting documents, things that you would need to go to a landlord with, like the ID, their income letters, proof of income, social security cards. So you'd be amazed to see how many people don't have the ID, who don't have that social security card, who didn't get their food share letter or their award letter from Social Security, which can take about 5 days for it to come in the mail. So you're at a loss of 5 days until you can present these documents. So that's one of the biggest barriers, the first barrier we come across. And then some people, because we're empowering them, we're creating a plan together. We don't do all the work. And some people, they're like, why can't you do it? Because we're not enablers, but we do get them motivated to do this. This is about you getting a house. I don't want to put you someplace because you may not like what I have. So I want you to be the driver of this car. I'm the navigator on the passenger side, but I can tell you that if you go straight on this road, we'll get to your goal sooner than later, depending on the size of the goal. To the left, there's a cliff. We hit that cliff, it's gonna be fatal. If you go to the right, you're gonna hit that brick wall, and it's gonna be fatal. So if we keep straight ahead on your goal, we'll get there. But however, if you want to go left or right, let me know so I can jump out the car. So, and that's a speech that I give to the clients. They chuckle and they usually say, okay, what do I need to do? They have tasks, I have tasks, and we meet up regularly so we can discuss where we are with the process and we continue that. It is a joint process. It's not the community health worker doing the work, but it's a joint process because I need for them to learn what to do if they ever got into a situation like this again. And then they can also teach another who's in the same situation that they know.
Sure, which is really empowering to be able to help somebody else.
Exactly.
Yeah.
And they usually do.
Michelle noted in the chat that she has refugees in her community, and sometimes getting resources can be tricky because of immigration status. So, what are your thoughts on that? I mean, that's like a whole other element to
Yeah, and we
navigate
and we
here.
have this when we do our as a CHW mentor. I tell people, when we have refugees and come into the community, most of them have a community already in the city or the state. Contact them. I've had to go to the Islamic Council. Where are your food banks for foods that are common and just the basics that you all eat? Because most people, we just give them food banks and say, here. But what if they need a kosher diet? What if they don't eat pork? You don't want to send someone to a food bank that does not give it. So I would tell you to check with to see if they have any of their cultural agencies. And they love Islamic one gave me so much information. It was like, okay, I just want to know a food bank on this side of town and that side of town. But they're willing to give you information that caters to their people. They're already in the community, so look them up. They are so willing to give that information. So I went to the Islamic Council. I talked to the Jewish Community Center here about where to get kosher pantries, where to get kosher foods. The Nigerian community had their own. So going to that particular refugees and see if they have something already. That way you can get them what they need that is beneficial to them, something they can identify with, because a lot of the foods we eat, they do not. So we want to be very specific about that and being very aware of the cultural differences and respectful of those as well. I hope that
I love that
answers your
idea.
question, Michelle.
I, I
Okay.
love that idea of coming with a like a learning mindset, right? Instead of being like, well, I can fix this for you. Like, actually, I there's a bunch of stuff I don't know. So like, let me go out and see what these partners can teach me instead of just assuming that you can figure it out. That's
Yeah, and that's the thing with community health worker. We are always in the community looking for services. We know that one client does not look alike. They are all not alike. They're individuals. They may have some of the same issues, but they're all different. And by going to different agencies looking for specific things, I just the other day, one of my clients asked me, I'm like, what is that? And she goes, oh, well, this is okay. Give me 2 days. My favorite line is give me 2 days and I'm going to research it, find out what it is, and come back with some answers. But it's always looking for resources, always looking for resources. Um, Michelle, I will give you my information because when it comes to interpreters, yes, I use them. I do not speak a second language, but I have lots of community health workers around me that speak pretty much every language of the main ones. So I grab them on like, hey, I really need you to translate for me, and they usually come out. Language lines, I hate them because they take so long, and they can
right.
only translate exactly what you say. If the person doesn't get
Wow.
it, they can't add their 2 cents. So it
Mhm.
makes it a little bit more difficult. But if you have someone in the office with you, I would say someone in the office that you can grab and have them sit with you or talk to the person with you. That works out better for me because I use language lines, but it's like, no, I need them to know this, and they say I can't tell them that. I have to
Mhm.
say exactly what you say. I can't
Right.
break it down, even though they know what I'm saying. The interpreter, they can't break
Mhm.
it down in their own words. So it makes it kind of difficult. And then
Mhm.
getting the ones like Rohingya, it's probably 4 Rohingya interpreters in the state. So if
A
they're
lot of my
missing,
a lot of my students will interpret for their families, but I'm picking up that some of them aren't totally interpreting, especially if I'm talking to their parent about their homework.
yeah, yeah,
And they're
no,
like, "Oh,
no,
she says I'm doing good." And I'm like, "No,
no,
no, no. It's not getting it
you
done."
definitely want another adult to relay
Right.
that. Um, you definitely want another adult to relay that. And that is one of the
Right.
traditional things in different families where the children would I usually ask for another adult that speaks English, especially school age children. They're just going to tell the good. They never
Right,
tell the
right.
bad or warnings. They never do that. So
Yeah.
even if you can get another adult relative to come,
Hmm.
I would do that as well. I'm always asking for family support.
Hmm.
If a person's in another county and we're working on housing an application, I'm gonna ask a family member, like, "Are you good at applications? Can you help me do this? I'm there in that part of the
Hmm.
city. I'm gonna be there like another day. If this can get done, they usually help."
I find that texting and emailing is great too because they'll have apps for
Translation.
translating.
Hmm.
Yeah, and
Yeah.
that's useful.
Yeah,
So,
awesome. Yeah, we have to do what we can in order to make these connections. Language is a barrier. in a lot of cases. There will be sometimes where cultural differences come into play. Sometimes you can offend without knowing to offend. So if I have someone on my detail, I was going into an Asiatic person's home, and she said, "Don't look them in the eye." I'm like, "Why? Is something wrong with their eyes?" And she said, "No, Lisa, it's very disrespectful." I didn't know that. So I would have went and looked at them eye to eye and thought nothing of it, and I would have been disrespecting them. And so it was good to know that going in. What else do I need to do? What else do I need to do? And she was just laying a whole list. I'm like, why don't you come with me to prevent me from doing that?
Mm-hmm. Other than homelessness and being a refugee, there's the trauma of that too, because you're not sure exactly what they had to go through to get where they are. So I have that with some of my students right now. So
Yeah.
lot of hoarding behavior, protecting their resources, things like
Absolutely.
that.
Absolutely. Because they don't know where the next meal is coming from.
Right.
So it's like, the meal sites usually close at a certain time. If they need something after, let's say, that 6 or 7 o'clock, then this is what, I'm going to shove these rolls in my pocket, these sandwiches, whatever I can put in this bag to eat later on. That's what they do. And it's so unfortunate.
Mm-hmm.
So thank you, Michelle. Awesome.
Thanks.
So I'm looking at families are willing to openly share their housing status, but staff have concern of a child's well-being. What kind of questions can we ask family students where we aren't overstepping our boundaries and we aren't assuming? That's that's a good question. It depends on how the student or who came to you. If it's a student, you would definitely ask the parent, or you can give the child some information like, if they really tell you what's going on, give you bits and pieces, you can say, well, here, take this pamphlet. You can call this number if it's the case. Or if they want their parent to come. Questions I would ask is, with children, it's different with children and adult. With the children, like, how did you sleep last night? They'll probably tell you crappy because I wasn't in my bed and we slept in the car. And that opens up the conversation. Oh, were you guys like doing a camping trip or playing some kind of game in the car? And as they tell you more, be like, oh, well, let me put this in your book bag. And as you get home or to the car or wherever they were, they can definitely give that information to the parent and hope that the parent will call. But I find most people are starting to call about their housing concerns because they've heard of WERA and they've heard of other agencies as well, coordinated entry. So they will ask. I would say just don't push. Just don't push them where sometimes we can ask questions and we can push them away because they're thinking, oh, the government will come get me if I talk to you, or you're going to send police to where I'm at. Especially those who are undocumented. That one takes a while. And I usually tell them, you can go here. You don't need there won't be anyone asking you if you're documented or undocumented. They're just going to help, period. So I hope that answers your question, Brittany.
So can you talk a little bit more, Lisa, about coordinated entry? Like just like what's a common example? Like how does that play out? It's kind of
Yeah, so
it sounds
um,
great, but I'm having a hard time wrapping my head fully around it.
coordinated entry, what they do is, so let's say I have a client, I'm looking for housing for that client. I may find that housing, but my agency does not pay rent and security. So I would contact my coordinated entry team. What they would do is put into the system that this person is homeless, they need rent and security, they're looking for housing. If I found the housing, I'll ask for rent and security. They put it in this statewide system for that point in time count, which is an accurate count of how many people are asking for services. And what they do is get the funding and they send the funding to the landlord for that person. So they mostly have funding to help and putting it into the bigger system for them to know how many people are asking for services. And this helps with the funding process as well. The bigger the need, the more money comes into your county. That makes sense for you?
Mm-hmm.
Okay. And again, there is a coordinated entry in every county. Some may have shared counties. You can check the Wisconsin Balance of State, and it has all the counties in there. You pick your county, and they tell you who the funding agencies are or who the person is that you would need to contact if you have a homeless person needing help. And that's a Wisconsin Balance of State.
Okay. Um, so one other question I have is, you talked a lot about like what you can do and sort of the right ways to approach things. What are like the top couple of like pitfalls to avoid? Like, what are some ways to just do it absolutely wrong? Because I know trying to do it all, it's like trying to do it perfectly is a great goal, but like, what are whatever you do, please don't do this. What are those like top 5 tips?
Don't try to put a person, especially if you're doing housing, don't put a person in the house because again, they're going to abandon it and you'll be starting all over for scratch. Give them the opportunity to make decisions for themselves. Don't enable. The goal is to empower. You're assisting for this brief ride. You're assisting. It's their life. They have to, for me, they have to have control over their life because I'm not going to be with them forever. And that's the thing. We're not going to be with them forever. So we're trying to set them up. I have referred people to a free course called Rent Smart if they've had an eviction. In most counties, that counts as a year of good rental history. It's through UWM. It's free. It's I believe a 6 hour course that they would take for free, and it becomes a year of good rental history. So don't assume everybody wants the same thing as well. Some people don't want to be, I don't want to be in an apartment building. I only like duplexes. I get that as well. So my goal is not to put you somewhere simply because you need housing, but it's to work with you to find some place where you're going to be there long term and we're not revisiting this. So I think the pitfall you're asking about, one of a barrier is the self-sabotage is a big one too. Mental health and behavioral health, that becomes an issue to people's housing as well. People get put out because of their behavioral health, which I think is just awful, in their mental health, because we know that this is a disease of some kind. So, but they get put out all the same. And who's going to take them, the next landlord, when you're saying, oh no, they had a behavioral health episode at my place? They don't want them. And that becomes a really big issue, and it's a big stigma out here. So when landlords see that, nope, it takes us longer to house these people. Yeah, that's one of the biggest ones for us.
Is there any kind of I'm sure there are, maybe you can talk about that. Like any efforts for like landlord education, just sort of landlords understand, what the experience of homelessness is a little bit better so that they don't sort of have that reaction like, oh, you had one episode and therefore like get out and
Some
like what?
do, and this is the good thing about mediating. I've had that. We probably shouldn't, but I give landlords, if I place a tenant or a member of ours in someone's thing, I give them my phone number, my personal cell. And
Brave.
yeah, pretty brave. But if you're doing it right, if you're picking the right person for the right property, you don't get a lot of those calls. And we're talking 7 years running doing it. I've probably gotten 2 calls And one person had missed getting their medication. And after I explained that to the landlord, I went and got the medication. Like, we can't, you'll get put out if you do this again. I could have the medication sent to your home. You don't have to get out because it's cold. But that landlord was very understanding. Some are not. Some are just like, go. No, we can't do this. But when we're remediating and they have my number and they know that I'm going to answer, it usually works out fine.
Great. Part of addressing the system, not just the individual, right?
Yeah, it's really tricky. Some landlords, they don't mind. Others do, with the mental health. Others are like, we just don't have the time and manpower. Some don't want them because they will call the police and they know that, they can't help it. I don't want them to have a police record, but they just can't stay here. So we get those things like that, which is unfortunate, but I do understand from a business perspective. They can do that.
Yeah. Do we have any other questions? Okay, I think that was sufficient wait time. Okay, we will come back again in about 20 minutes. Lisa, that was fantastic. I learned so much from you. I admire you so much. This is just incredible, incredible work. And I love this idea of empowerment, not enablement. I'm going to take that with me
Oh,
to a lot of places.
absolutely. It works
Yeah,
out. And then you give them the opportunity to say, look what I did with Lindsay's help, or look what I did with Michelle's help, or look what I did with Abby's help. So it's all about what they did. So it gives them that sense of hope and power where they are ready to take on the next challenge whenever they have one.
yeah, it's really, really incredible. Thank you so much. Yeah, like I said, we'll see you back in 19 minutes, 10:55. We'll be back and we'll be talking about food insecurity.